here to tell you all about Healthy Ireland and the National Physical Activity Plan, which is the policy under which we're attempting to get Ireland active. So basically this policy fits under the umbrella of the Healthy Ireland framework, which has already been mentioned by Kate and the Minister. So the vision of Healthy Ireland is basically where everyone can enjoy physical and mental health and well-being to their full potential, and where well-being is valued and supported at every level of society and is everyone's responsibility. As was said earlier, the health sector can't do this alone, so the very principle of Healthy Ireland is that it's done in partnership across government as a sort of joined up government policy. The Healthy Ireland framework is basically an umbrella under which a lot of other policies would sit. That would include the National Physical Activity Plan, the Obesity Policy and Action Plan, Sexual Health Strategy, Tobacco Free Ireland, and a whole bunch of other policies that are there to improve national health and well-being. So Healthy Ireland has a few overarching goals. One is to increase the proportion of people who are healthy at all stages in life, to try and cut down on that chronic disease and to make sure people have the opportunity to stay healthy for as much of their lives as they can. To reduce health inequalities, as the Minister mentioned earlier, we, like most countries, would have a gap between advantaged communities and disadvantaged communities there, and we need to try and reduce that in as much as we can to try and give everyone a fair chance. We want to also protect the public from threats to their health and well-being. Now, there are many of those. I mean, we would have obesity, fast food, tobacco, excessive alcohol use. So the idea would be that basically this policy framework would attempt to try and reduce the harm from those things if they're excessively indulged in. We also want to create an environment where every individual and every sector of society can play their part in achieving a healthy Ireland in as much as we can. So there are a few themes for action on Healthy Ireland, sort of governance and policy. So we will build policies that would help to build a healthy Ireland. Empowering people and communities, so things like local sports partnerships, schools, everyone can play their part, and there would be facilities there at a local level for people to join in with. Research and evidence, monitoring, reporting and evaluation, that would be about both research projects and surveys that would basically collect data from the population. For example, the Irish Sports Monitor that would collect information as to how active the population in general is, or the children's equivalents, which would be the health behaviours in school children, and the children's sports and physical activity participation study, which is currently being repeated. So there's a bunch of initiatives underway there. And also health and health reform, so the HSE are doing health service executive to anyone who's not from Ireland. They would be implementing a bunch of initiatives that would be involved in sort of putting in more health promotion, but also things like making every contact count. It would help to intervene with patients in terms of things like smoking, drinking, weight and physical activity going forward. And the big key principle there is partnerships and cross-sectoral working to make sure that all relevant bits of government are talking to each other in order to make Healthy Ireland happen as efficiently and as well as it possibly can. So in terms of what's been done already, Healthy Ireland was launched in 2013, and as of now we have policies and action plans in place with regard to physical activity, obesity, tobacco and alcohol use, mental health, healthy and positive ageing, sexual health strategy, better outcomes, brighter futures policy that is talking about policy for children and young people and has the aim of making Ireland one of the best countries in the world for young people to grow up in. All of these have been published and are being implemented both in their own right but as components of the Healthy Ireland framework. We've added cross-sectoral structures and relationships. So for example, when we were putting together the National Physical Activity Plan, there would have been a cross-departmental group with inputs from all of the relevant departments, and the implementation group would be the same. It's not just health that's there, it's basically health and sport and education and representatives from the HSE, the academic community and the Department of Housing and a bunch of other organisations. So also embedding in policy change and HSE reform to push forward the aims of health promotion. The Healthy Ireland survey has been running on an annual basis since 2015. So this is a survey that basically asks 7,500 Irish people every year about their health behaviours. So there's different modules that go in every year. Some things are asked about every year, like smoking, alcohol use and diet, and other things are rotated in and out. And we ask about how Irish people feel about their health and what they're doing, and health behaviours in general. And that's a very useful adjunct to policy in that it's giving us data to support changes that we're making, and it basically can also show us as to what effect current policy is having out there in the field. And finally, the Healthy Ireland Fund has been established, so that has 5 million allocated in 2017 and another 5 million in 2018, and that is being spent on local and national programmes that are basically supporting the Healthy Ireland agenda. So a large proportion of that is being devoted to physical activity, and it is the vehicle by which the Active Schools Flag programme is funded from the health side. It was initiated by education and is also funded by them, but the Healthy Ireland Fund is the vehicle where the health contribution would be coming from. So Healthy Ireland also has a communications campaign. This was launched in 2018 in January and ran for a few months, and the summer section of that campaign is being launched tomorrow. It's basically led from Healthy Ireland and with a lot of help from the Taoiseach's department. It has 3 themes, so healthy eating, physical activity and mental well-being. So eat well, be well, think well, and for anybody who wants to see what's going on with that, it will be well publicised on our Twitter and websites, and if anyone's listening to the radio, I'm sure you'll be hearing the radio ads shortly as well. So, Healthy Ireland implementation. Basically, it's a new opportunity to shape the national discourse on health and well-being, and to refocus efforts on prevention and keeping people well, empower people to look after their own health and well-being, but also to give them opportunities to engage with stuff that will also help. So it's addressing priority issues in a collaborative approach and hoping to build a new culture and philosophy around health and well-being. So the focus is really on prevention. So the Get Ireland Active, the National Physical Activity Plan for Ireland, was launched in early 2016, and it's a key component of the Healthy Ireland framework. So it was a joint project between the Departments of Health and the Department of Transport, Tourism and Sport, so that would be the sport bit of that department. And we have representation from other government departments and agencies, and also from the research sector. So some of our key partners would be the Department of Education and Skills, the Health Service Executive, Sport Ireland, which is the agency of the Department of Sport that runs a lot of the sport, Department of Children and Youth Affairs, Department of Housing, Planning and Local Government, Local Government Management Association, which actually has representation from the various local councils. And from the research sector, we have a number of researchers who are interested in the sociology of physical activity and who contribute to the implementation group. So the main aims of policy is basically to try and increase the percentage of people who we would classify as being highly active. So those would be the people who would meet the Irish National Physical Activity Guidelines, which I think are based on similar guidelines from the EU. So what those standards are is basically that adults are supposed to be moderately or intensely active for 30 minutes a day, 5 days a week, and children are supposed to be active for an hour a day, 7 days a week. And for disabled and older people, they are supposed to have similar guidelines to adults where their disabilities or conditions allow. So basically the idea of the National Physical Activity Plan is to increase by 1% the number of people who are fully meeting those guidelines over the lifetime of the Healthy Ireland framework, which is 2013 to 2025, and I'm sure we'll continue beyond that, but we'll just need a newer policy at that point. So anyway, the National Physical Activity Plan is set out in 8 sections or action areas. So the first one is public awareness, education and communication. That would be enable people to better understand the benefits of physical activity and how it improves their health and how to become more active. So there's a number of, we have a presence on websites, so there's the Healthy Ireland website, getirelandactive.ie, and the Healthy Ireland website is actually being moved to www.gov.ie over time. There's the Healthy Ireland 2018 communications campaign, and there will be further communication campaigns after that. We are extensive users of social media. We also, the Healthy Ireland Fund co-funds Operation Transformation, which is the national state broadcaster, RTE, broadcasts this, and there's been ordinary people participate and they get weighed and they increase their activity, and it's shown on TV as to how that affects their health. I think there was a number of years ago there was some engagement from a lot of the TDs in Dáil Éireann as well, so we were able to watch their progress on their fitness plans. There's a number of local initiatives such as Men on the Move, Women on Wheels, local walking groups which are supported by Get Ireland Walking, there's Park Run, a bunch of local initiatives that people can engage with, and we're sort of trying to publicise those and make sure that people know that they're out there and they can get in there and do stuff. We also support the European Week of Sport sports. That's the Great Dublin Bike Ride, which actually is expanding every year. They're having to move site this year because they had over 6,000 people last year and there wasn't room for them in Smithfield anymore. So I think this year they're planning to move to Merrion Square. There's National Fitness Day, which is run by the local the gym supportive organisations, gyms and leisure centres. It's Ireland Active, and they offer sort of free tasters on National Fitness Day. So you can go into your local gym and leisure centre and see if you'd like to try something that you then might take up long term. And there's a soccer fest, there's a bunch of other activities that go on. The European Week of Sport is normally in September. So action area 2, so this is most relevant to what we're here to talk about today, which is the Active Schools flag. So in this area we'd have a lot of really good input from the Department of Education and the Department of Children and Youth Affairs. Here what's been really great actually is a number of new initiatives from the Department of Education. So the first one, has been mentioned before, would be the junior cycle Wellbeing curriculum, which is, amongst many other things, increased the number of hours available for PE, and is also putting in a new curriculum for social, personal and health education, SPHE, and the civic, social and political education as well. So there's a really all-encompassing new wellbeing curriculum that's going in there for years 1, 2 and 3 before the first state exam at age 15 or 16, which is the junior certificate. And they're also putting in a programme starting in 80 schools, I think in September, which is the senior cycle PE framework and the Leaving Cert PE for people who want to take PE as an examination subject. So that hasn't been available in Ireland to date, but it will be now, and it's a really great initiative. So there's a number of things that are supporting that. The department is actually helping to fund a FIS app that will support the senior cycle framework, but also the Active Schools flag is involved at the primary school level and is beginning to be expanded to the secondary schools level as well. So there's a lot of stuff happening in schools at the moment. There's also support for the professional development service for teachers, who are rolling out continuous professional development for teachers in terms of emphasising the importance of PE. The Department of Children and Youth Affairs and the Healthy Ireland Fund are providing additional support to the Children and Young People Service Committee. So these are in local authorities and they coordinate local services for children and young people, and basically there's been some additional funding for new initiatives under that. And then basically there's a bunch of representative organisations for the children themselves called Corlin and Og and Hub na Nog, where they actually have school pupils themselves can engage with some of the policy that affects them. There's policies like Active Play Every Day, Smart Start and Asha, which are all aimed at younger children. And then for people at the other end of the young people age spectrum, we're beginning to develop a healthy campus initiative. For example, University of Limerick has just rolled out a smoke-free campus. So basically there's a bunch of stuff going on there on the health and wellbeing for young people front. So the Health Service Executive is also doing a wonderful job of rolling out something called Making Every Contact Count. So the idea with that is basically that medical professionals and health professionals will be able to intervene with patients on the things that matter in terms of health protections. That would be smoking, alcohol use, weight and inactivity, in terms of being able to just intervene with patients and sort of say, you know, would you like to do some different stuff around this? So this is basically a module on this has been incorporated into the undergraduate curricula for university courses for health professionals. So that started in September 2017, and the HSE is beginning to roll out continuous professional development for its own staff in this area currently at present. So that's a really great initiative that will help patients down the line to improve their health behaviours. So the environment, of course we all know that the environment is really important in terms of promoting health in that either facilities are there for health and well-being and for recreation and for walking, or they aren't. So this area is basically supposed to take a look at the built environment and to try and to help people to use it more efficiently and for more initiatives to be put out there. So we have initiatives in terms of the National Planning Framework, which is Ireland 2040 Our Plans, that was launched in early 2018, and that will provide additional capital money for things like cycle lanes, outdoor facilities, as well as many, many other things. But the funding for that will be available for local councils to apply for stuff in late June, as far as I'm aware. There's the EU Healthy Cities and Counties programme that people are applying for and joining. We have a number of healthy cities and counties, and the number is expanding. A lot of the city and county development plans are going to be putting an increased emphasis on physical activity and active travel, so cycling and walking. There's a lot of development of greenways going on at the minute. The Mayo one and Waterford one have been very successful in terms of tourists and attracting people onto them, so there's a number of other counties such as Clare and anyways, or thinking of doing so. And I think the guys in Laois have put in place a mountain biking pathway across the Slieve Broom Mountains, and it's a very active area of development. Workplaces, we're putting in a national framework for healthy workplaces that covers a lot of different workplace behaviour, but also has an emphasis on smart travel, active travel, and healthier methods of getting around the place in addition to other health behaviours in the workplace. That's in development with the Department of Business, Enterprise and Innovation at present. Sport and physical activity in the community, this is something which the Department of Sport and Sport Ireland are very active in, along with partner organisations. They have a lot of initiatives going on there, so both at local level we have community hubs and sport and physical activity hubs, and the local sports partnerships which have representation from a number of organisations including the HSE at local level, and will let people know about what's available in their community. As sports development officers, we have a number of national programmes: Get Ireland Walking, Get Ireland Cycling, Get Ireland Swimming, Get Ireland Running, and Cycle Right, which is a cycle training programme for young people. So those are all now receiving a little bit of funding from the Healthy Ireland Fund in order to give them a bit of a boost. There's a national sports policy which the Department of Sport is going to be launching in the next 2 or 3 months, and that's under development and will provide additional resources for sport and participation as well. The CARA organisation is basically there for people with disabilities to provide more, where your disability allows, to provide more opportunities to participate in physical activity. Also a little bit of support for the Special Olympics Young Athletes programme. And Sport Ireland, of course, provides a large amount of funding to the national governing bodies of sport. So just to show you one local initiative there, that's the millionth Park Run celebration there, with our Minister out front and foremost participating there. Park Run runs Park Run in 77 locations and a junior Park Run in 14 locations. Then research monitoring and evaluation did cover a bit of this, but there's a few successful research programmes running, and we also have the surveys. There's the Irish Sport Monitor, Healthy Ireland Survey, and the Children's CSPA and HBSC surveys, which all collectively will give data in terms of how many people are active. Also the Irish Longitudinal Study on Ageing, which looks at older people and does have a module on their activity levels. And the departments also support in various ways a number of different research projects in terms of successful interventions, what works out there in the community and how can we expand it. Won't go into too much detail because I'm running out of time, but just basically to say that the real key thing about both Healthy Ireland and the National Physical Activity Plan is basically the partnership and going forward with this together. So we have a first progress report that was published in November 2017 on the Healthy Ireland website. And just to say that the WHO will be publishing a country file that ourselves in sport, with help from our colleagues in education and other departments, have put together, which basically collectively catalogues most of what Ireland is doing in the physical activity space. And then just to say where we are at present, currently about 32.6% of adults are meeting the PA guidelines according to the recent Irish Sports Monitor. The 2010 data with regard to children is less good, but having said that, the children physical activity standards are a bit more onerous. That study is being repeated currently after almost 10 years of implementing more policies, including the Active Schools flag with regard to children, so we're hoping maybe the rate will go up. Boys are more likely than girls to meet the guidelines, but according to the Irish Sport Monitor, the gender gap is narrowing and women are becoming more active, so that's a good thing. And the Irish Sport Monitor would also show that recreational walking is up 2% from 2015, which was the last time the survey was run, and this is the 2017 version. So there is some pretty optimistic stuff out there about participation in individual sports. The Active Schools flag, I might just leave that mostly to Karen, but it aims to get more schools more active more often, and in that regard it is very much part of the National Physical Activity Plan and helps to promote the aims. So we have a National Physical Activity Plan target that was suggesting that we should have 500 additional schools that would have achieved the flag by 2020, and so far we have 403 and it's only 2018, so we're doing pretty well in that regard. And basically that's how that fits in. That is a picture of An Taoiseach, who's launching the Active Schools Week along with Minister Bruton, Minister Byrne and Minister Harris, I think, a few weeks ago. And he was launching that in the school in Blanchardstown, which is northwest Dublin. And just to re-emphasise that partnership is the key to success, and I hope you learn as much as you possibly can with regard to spreading this really useful initiative across Europe. Social media.
this early, that it is